It has been a full year since the discovery of SARS-CoV-2 in China and the classification of the COVID-19, the disease the SARS strain causes. More than a full year after the initial outbreak, and the world is still grappling with the worldwide pandemic caused by the rapid transmission and spread of COVID-19. As of the date in this video's production, there have been over 109 million cases and 2.4 million deaths worldwide. In comparison, the 2003 SARS outbreak resulted in over 8,000 confirmed cases and 774 deaths, according to the CDC, while the 2012 MERS outbreak had, according to the World Health Organization, over 2,500 confirmed cases, with 866 deaths globally. While all three diseases are caused by coronaviruses, COVID-19 has been significantly more contagious and deadly. Despite the catastrophic loss of life, some still believe that COVID-19 is akin to our seasonal flu. This begs the question, what distinguishes SARS-CoV-2 from other similar viruses? SARS-CoV-2 is a novel coronavirus that causes the disease COVID-19. Transmission of SARS-CoV-2 is most commonly performed through close person-to-person contact, typically less than 6 feet. Respiratory droplets produced when an infected person talks, coughs, or sneezes are spread into the environment and can land in the mouths and noses of nearby people and be inhaled into the lungs. Alternatively, COVID-19 can be contracted through airborne transmission, where droplets linger in the air for an extended period of time, even if the infected person has left the area. This typically occurs in enclosed spaces with inadequate ventilation. Less commonly, infections can occur through contact with contaminated surfaces. Respiratory droplets can settle on surfaces, and if touched by a person, can be contracted through transferred contact from the hands to the eyes, nose, and the mouth. Similarly, influenza is spread mainly through close person-to-person contact via respiratory droplets. The main differentiation between COVID-19 and the flu in terms of spread would be the period in which an infected person is contagious. Both COVID-19 and influenza are respiratory illnesses and exhibit similar symptoms. Common symptoms between the two are fever, chills, difficulty breathing, runny or stuffy nose, coughing, fatigue, body aches, and headaches. Vomiting and diarrhea are also possible but are more prevalent among young children than adults. A distinguishing sign exclusive to COVID-19 would be a change in or loss of smell or taste. Because both diseases share common signs and symptoms, it can be difficult to diagnose an ill patient based off of symptoms alone. Testing may be needed to confirm a diagnosis. If you or a loved one experience any trouble breathing or a persistent pain in your chest area, seek medical attention immediately. Dr. Carl Schultz, Director of Emergency Medicine, and Steve Thronson, Deputy Director of Medical Services at the Orange County Health Care Agency, provided valuable input on when it is appropriate to visit the emergency room in a recent interview.
Nowadays, you hear someone at work or at the grocery store sneeze or cough, and everyone looks at that person. So, like I mentioned earlier, I have, bad allergies. So I get tested kind of regularly just to let my coworkers know, yeah, it's my allergies again. I don't have COVID. Otherwise, they feel uncomfortable when I sneeze or have a runny nose. I almost have to test on a defensive mode to make my coworkers feel safe that I just got my normal allergies.
Sometimes it's very difficult for a layperson to know when they've crossed the threshold and probably ought to see somebody versus I can just stick it out. But there are some things that are helpful as a guide. The shortness of breath is a big deal, and with COVID, if you get short of breath, the risk to you is substantial. So you may have fevers and body aches, but if you're really not short of breath, and how would you know that? Well, again, I said it before, but it's a great test. If you can walk up and down a set of stairs, from first floor to second floor, and be pretty comfortable when you get to the top of the stairs, you probably aren't in any real danger from COVID. On the other hand, you get to the top of the stairs, or you can't even make it to the top of the stairs because you're so short of breath. That's a pretty significant finding, and you probably need to see somebody. There's a couple other things. Having trouble sleeping. So if you can't sleep lying down, if you get so short of breath when you lie down, you can't sleep, and you have to sort of prop yourself up on pillows to sleep, that's not a good sign. And if you're becoming either fatigued, you just don't have enough energy, you can't even get up and feed yourself, or people are around you are starting to say, you sound confused, like you don't know what you're doing, you don't know who you are. Those are all things that suggest you're in more trouble, and definitely should see somebody. But it can be hard. You can be mildly hypoxic. You can have low oxygen levels, not drastically low, but a little bit low, and still pretty much not pick it up. So that's a harder call. I would say when in doubt, if you can talk to your personal physician, if you have one. Some people, they don't have health insurance and they don't have a doctor, and I get that. If you happen to be fortunate enough where you have a primary care provider, you can call them and talk to their nurse or something and say, does this sound like something I ought to get checked out for? And they can sometimes help you make decisions. But I would never discourage anybody. If you don't know and you're worried, a lot of people are going to be worried, and I get that. But if you're worried and you honestly don't know, that's what emergency departments are for. And we probably see more people that should have gone to the ED that didn't than the other way around. So, yeah, I mean, if you feel pretty good and people are just saying, well, you can never be sure, that's not a good reason to go. But if you're starting to feel not so good and you're starting to wonder about how well you're breathing and you seem to be having trouble sleeping and trouble eating and you can't walk up and down the stairs as much anymore, you probably ought to see somebody and get to the ER.
COVID-19 typically enters the body through the nasal and oral passages. Once inside, the virus comes into contact with the cells in the throat, nose, or lungs, attaching to the angiotensin converting enzyme 2 receptor molecules on the cells and inverting itself into the cellular membrane. From that point, the virus will attach to the ribosome and begin genetic replication. Viral proteins are formed and sent by vesicles to the outer cell membrane to accumulate in a new virus cell. Unless stopped, repeated replication by the virus will continue to commandeer human cells and will travel further down into the lungs. In response to viral attack, our body's immune system is activated. An inflammatory response is produced as the body attempts to fight the invader. In some people, about 15%, this immune response starts a cyclical overreaction of the body's immune system, called the cytokine storm. Under normal circumstances, the response peaks early, clears the virus, and helps produce antibodies and T cells specific for the virus. But in some COVID-19 patients, the cytokine response sticks around too long and too strong. Immune cells can attack healthy tissue which can result in blood clots, blood pressure drops, and organ failure. Further complications can arise once the virus reaches the lungs. It attacks the ACE2-rich cells that line air sacs in the lungs. An immune response in the area leads to inflammation of the lungs in an effort to neutralize the virus. However, this process can overcrowd the already weakened air sacs and reduce a patient's oxygen levels, resulting in coughing, fevers, and breathing problems. In addition, patients may contract pneumonia as the air sacs fill with fluid. In more severe cases, COVID-19 patients may develop acute respiratory distress syndrome, a form of lung failure, and may require ventilators to help breathe. Rarely, complications can occur with both the heart and the brain. Little is known about how COVID-19 attacks the heart, but cardiac issues such as heart failure and abnormal heart rhythms in some COVID-19 patients are thought to be the result of the body's inflammatory response to infection. Additionally, a number of brain-related conditions have been seen in COVID-19 patients, including strokes, seizures, and brain fog, which may be the result of inflammation, organ failure, or oxygen deprivation caused by the virus. While anyone can be infected with COVID-19, most will exhibit no or only mild symptoms. However, elderly citizens past the age of 65, those with vulnerable immune systems, and people with underlying health conditions such as heart and lung disease are at high risk of severe illness from COVID-19. Children can also be classified as high risk, as their immune systems are not fully developed yet. In comparison with the elderly though, they hold less risk of contracting a severe case of COVID-19. This is because elderly citizens are far more likely to possess an underlying disease, which, coupled with their ailing bodies, puts them at a much higher risk to develop severe COVID-19. COVID-19 possesses several attributes that elevate its transmissibility and lethality when compared to other similar viruses, such as the seasonal flu. We must remain vigilant and perform our due diligence to prevent further spread of the virus. Try to limit your public outings, and if you must go out, follow social distancing guidelines and wear a mask.